Depression has become increasingly common among teenagers here in the United States. In 2020, 17% of teens said that they had experienced at least one major depressive episode in the past year. Now, a new study is shedding light on the impact depression is having on teens who have type 1 diabetes. Joining us this morning via Zoom are Dr. Susana Patton. She's a principal research scientist with Nemours Children's Health, and Dr. Arwen Marker, a pediatric psychology fellow with Primary Children's Hospital in Salt Lake City, Utah, who's also a co-author of this study. Good morning to both of you. Thanks for joining us.
Good morning. Thank you for having us.
So, Dr. Marker, let me begin with you. Could you tell us more about this study?
Yeah, so previous research has shown that 1 in 3 teenagers with type 1 diabetes has depression, and that is significantly higher than what you just mentioned for teenagers generally. And so we wanted to look at being able to screen and identify those teenagers who have depression and diabetes. And right now there is both like the American Academy of Pediatrics as well as national and international diabetes guidelines that tells us that we should start screening every teenager with diabetes for depression at age 12. And so we looked at different screening measures, so questionnaires that teenagers can fill out, and looked at how accurately they're identifying depression. And what we found is that we actually should lower cutoff scores to make sure that we are not missing any teenagers with depression, and so none of them are falling through the cracks.
And Dr. Patton, would you explain the study's importance then to not just teenagers with diabetes, but also their parents need to be aware of this as well?
Yeah, certainly. We know that we know that depression makes it harder for adolescents to engage in everyday activities. And if you're a teen who has type 1 diabetes and depression on top of that, we know that it can make it hard for them to perform their daily diabetes care. In a typical day, youth who have type 1 diabetes, they need to take insulin, they need to do a variety of other self-care behaviors to stay healthy. And if depression makes that harder, that's serious. It can increase the risk for high blood sugars, more variable blood sugars. And that's something that increases the risk of complications and something parents can certainly keep an eye out for.
And now I want to talk about some warning signs in just a minute, but Dr. Marker, I mean, what are the important takeaways here?
Yeah, so I think one really important takeaway is that for people to fill out questionnaires honestly when you're asked these questions frequently. I know many families, you've probably seen either yourself or your teenager fill out a questionnaire like this when you see your pediatrician. And so really important to fill those out and to take those recommendations from your doctor, and so that you can get resources when you need them. And for providers, we found that we should, lowering those cutoff scores means that, for example, if you're filling out like the patient health questionnaire is a common one that's used, rather than including all teenagers with a score of 10 or above to be able to get them resources and services, it would be actually for kids with diabetes at 5 or above. So realizing that we need to, even at a lower screening score, be intervening and helping these teens.
Yeah, focusing on the teens in particular who might be really especially in need, and also for the teens, it's okay. You're not going to get in trouble by filling this out and being honest on the survey. So Dr. Patton, to the parents who are watching, what are some warning signs they need to recognize?
So depression can look different for a lot, but we know that some of the general symptoms are changes in appetite and sleep. We know that teenagers can be particularly anxious, moody. They can be irritable. They can lose interest in activities. They can be frustrated, and often will withdraw from friends and family. If parents see these signs or symptoms, it's important that they go ahead and have an honest conversation with their teenager about their feelings. Let their teenager know it's okay to talk about depression. Many people experience depression, but we have good treatments available for depression. This is also something they should mention to their child's primary care physician or their child's diabetes team, so they can help the family get the resources and support we need. It's just really important that we create a safe space so that our teenagers know it's okay to talk about depression.
Communication is key, without a doubt. It's not always easy communicating with teenagers, but it's so important to ask the right questions. Doctors, thank you for your time this morning. We really appreciate it.
Thank
you
you
so much for having us.
We'll be right back.